Without the entire team inside the healthcare system, nurses and doctors really can't do their job alone. They need everybody inside of the hospital, and they most certainly need medical radiation technologists. Our main title is that we acquire the images, but really the technologist is much more than that. A lot of the time we act as, counselors, coaches, and even kind of advocates for the patient. Not only are we working well over full-time hours, we're also expected to cover call. So through the night, on our off hours, we're being asked to come back and forth to the hospital 3 or 4 times during the night, and then expected to get up the next day and head back into work as well. So if you're spending all that time at work, you're not spending that time with your family. If we aren't available, the emergency departments sometimes have to close because we can't have an emergency department without a licensed X-ray technologist. The wage should reflect the quality of education we have. It takes the same amount of time to do a degree for the Bachelor of Health Sciences as it does for nursing, except for our wages and the nursing wages are considerably different. If you were a student starting school, knowing that you could spend X amount of money becoming a nurse or becoming a MRT or with a Bachelor of Health Science, knowing that, if you make this much money with a Bachelor of Health Science and this much money as a nurse, knowing that the education's the same, the quality of the education's the same, the length of the education is the same, and the cost of the education is the same, I think it's a no-brainer. If we want more X-ray technologists, we have to pay them what they're worth.